My mother got in the hospice program, and they were fabulous. But I remember they were out there 3 or 4 days a week, working on their bed sores and all the things that people who are bedridden need. She loved them.
I'm a grateful patient of the hospital. I had a mild stroke, if you will, if there are such a thing, about 2 years ago, which was a result of a hole in my heart. The neurology department as well as the cardiologist worked on me, and wonderful physicians.
What I liked about St. Vincent's was their mission. And I will tell you that, everybody up and down the line is committed to the mission, which is bringing better health care to Oregonians, Washingtonians, wherever they are.
The foundation is a difference maker at Providence St. Vincent. We support activities that really make Providence, Providence. We're 153 years old. We're older than the state of Oregon. We started in the Northwest in 1856. Pioneering sisters of Providence came from Montreal and put a stake in the ground and said, we're going to serve the Northwest. They moved out into the woods, which at that time was the West Hills, and they built a hospital there that persevered from 1895 to 1970. Thousands of babies were born there. Heart surgery was pioneered there. And then we moved from the downtown area out to our current location in Beaverton in 1970. And it was during that time period the foundation was started.
One mother came in, I was holding her baby, and she walked up and she looked at me, and I explained to her, I said, I'm a cuddler. Would you like to have your baby? She says, no, but I am so thankful you're here. She says, because I have to work and I can't get here till later in the evening. At least I know he's got someone to cuddle him.
They've got several centers of excellence that the foundation is instrumental in supporting. The Heart Institute, which is now got a new valve program that we will be, I think, the only hospital in the country using it for replacement of valves. We have a Brain Institute, which focuses on stroke and MS and some of the other problems we have. And another area is cancer, and St. Vincent has the Ruth J. Spear Breast Cancer Center, and we're just opening up an orthopedic center of excellence to focus on orthopedics. They need the best technology, and the best technology is something that really the hospital in its operations can't necessarily afford the cutting edge things, and that's where the foundation steps in. The other big role I think that the foundation plays, and it's really the one that I think is so critical in this day and age, which is charity care. It's really helping people that are underinsured or uninsured pay for the medical care they get at St. Vincent.
Providence Foundation offers this great scholarship for nurses. It pays 100% of your tuition. Most programs in the area would have been prohibitive just because of the financial burden. So without, this scholarship through the foundation, I wouldn't have went to nursing school.
There was a patient who was dying and about to die, unfortunately, but that her husband was unable to afford his rent, and was at the same time that his wife was dying, was about to be homeless. And she asked if the foundation couldn't do something. So we stepped up and gave a contribution to pay for his rent for a couple of months so that he could get back on his feet. And that's the kind of thing that's really meaningful. And it's why we're there.
There's some people who talk the talk but don't walk the walk. Well, they do both. They talk the talk and they walk the walk. And they're delivering great results. So my motivation is I want to help them deliver better results.